that there are three keys to success for any good process improvement methodology or program. And in my experience working with organizations like yours across the country, when I see these three things in place, I know that the process improvement methodology is working. So as I mention these, think about your organization and what you see. So the first is executive engagement. This doesn't mean that the word comes down from on high, we are going to implement process improvement, this is going to be a new day. This is not just a mandate. This is when the executives, sure, they may make a mandate that we're going to implement a process improvement methodology, but then they roll up their sleeves. The second key to success is goal alignment. Now, if you've worked with, in our health systems, we've gotten so complex over the years that often you'll have different and sometimes competing goals with stakeholders across the system. It is remarkable how fast the boat can go when everyone is rowing in the same direction. So to make a process improvement methodology work, line up your stakeholders and then get them all to have skin in the game by sharing the same goal. If they share that goal, the boat will go faster, everyone's rowing in the same direction, and it is remarkable how quickly things start to change for the better. And then finally, flexibility, and this one can be a little tough for process improvement people because we're passionate about our methodologies, sometimes almost dogmatic about it. We get good results when we're very black and white and we follow the program. However, we need our care teams, the clinicians and physicians that are working with the patients, they've got to be part of the process. Vidant is a larger health system. It's a 9-hospital system in eastern North Carolina, and it's an interesting part of the country because it's fairly rural, and yet there's this Greenville, North Carolina, an academic medical center there that is 900 beds. So it's this juggernaut in the state. The challenge there is working in this rural setting, engaging physicians that come to work there. There's not a situation where you might have at your organization where you have the physicians can practice at multiple hospitals. Vidant Health has pretty much a monopoly there in terms of there are no competing hospitals, but you still have to engage with the physician. Reducing variation is a critical step in this transformative process. So the leaders at Vidant are seeking to engage physicians so that they can reduce the clinical variation, and then that should lead to cost reduction. So that was their mandate. I think one of the brilliant things that Brian Floyd, the CEO, did was include a process improvement methodology. And he selected Plan, Do, Check, Act, and he selected it because his nurses were familiar with it. So it was already part of their culture. Well, we talk a lot about supply chain and cost reduction, but the scope at Vidant was much bigger. Brian's vision is that this system of management should be an architecture through which any change initiative should go. So it's very broad and it encompasses all of operations. I think there were two main benefits that the partnership provided, and they both relate to the system of management. First, Brian's vision was fairly new when we started with this enhanced partnership, and he had just started communicating it around and building the knowledge and awareness with his management team and their teams.
We traveled to Vidant Health as well to learn more about their performance improvement efforts. We're going to feature our interviews with their key stakeholders.
Hospitals have a mandate to deliver the kind of care that they promise the communities and the people that they serve that they are going to deliver. And we've known for years that error is going to exist, that waste is going to exist in such a big, complicated environment as healthcare has become. And particularly in large hospital settings like the one that we're in here, the complexity in and of itself introduces the potential for waste or the potential for error and all those things. And only an organization that is really committed to the ongoing pursuit, diligent process improvement, always looking for how something can be better than what it was yesterday, is really going to be able to deliver the promise of safe and high-valued care into the future.
This day and time, as we look to the future of healthcare, process improvement literally addresses, in my mind, the matter of our being able to look at our systems, look at the way we do things, and to improve that operation. Be that from a perspective of how we go about providing and delivering patient care on nursing units, or in the area of supply chain, how we go about doing our supply chain processes.
I have been doing this a long time, and I can tell you that in the past, process improvement really was not an issue. Somebody would say, I need something or I want something, and it would happen, and nobody really looked at the outcomes of it, or how much it cost, or what was the return on investment, or worried about what the payment was going to be for that procedure. And so over the last 15 years or so that I've been practicing, that's really started to come into play, especially within the last 5 years. There's a lot of good literature coming out recently looking at variation in care, and that's one of the big drivers for variation in outcomes. And so if you can identify what are the best practices, both as far as equipment being utilized, the surgeries being performed, how to do the procedure itself, and then the post-op and pre-op management of the patient, all of those things, you can identify best practices that allow you to improve your outcomes, to decrease your hospitalization, and to make things better for the patients. And all of those things are going to end up weighing into how much you're reimbursed by healthcare funding institutions.
Organizations are typically looking at driving out waste for a couple of reasons. There's that bottom line, that cost savings initiative around driving out waste, but there's also the process side around that. And process is really, for me, that part about changing your systems where they create a safer environment for patients. And if you're using lean methodology and marrying with Six Sigma methodology and you use them correctly, you can achieve both of those goals within your organization.
I talk to my team all the time. It's almost as though we just built the hospital last year and started running it. How have we been doing this for these many years if we keep finding reasons to keep redoing the way we conduct our business? Eventually, most programs have a lifespan of a few years, and then people kind of go back to doing what they're now comfortable doing. And so for us, we launched into a new way of looking at process improvement by creating a system of management, really to deal with the distraction of all the issues going on in healthcare today and make sure that we can really focus in on what's most important for every patient that we're serving.
No longer is process improvement as it relates to cost savings initiatives a initiative du jour. Literally, this is called being able to do our mission, to be able to accomplish our mission critical needs. It's called survival.
Good process improvement is a 3 to 5 year investment, and that is what research shows. So in order for us to see these results in healthcare, we've got to be in it for the long haul. And that means leadership teams, they have to, we're back to that executive engagement, Mike, rolling up the sleeves and then staying on the ground for 3 to 5 years. It is a relentless focus on continuous quality improvement.
We would do this kind of work, and it would go on for so long before the end of an improvement and a measurable, end state that told us we did a good job. That could go on so long and be one of so many initiatives that people never really saw or felt the improvement. The system of management, we said we've got to find a way to shorten the cycle so that we start something, we complete something, and everyone feels that win, and that we're not as fragmented in the process as we were before. So we are in 90-day cycles of turnaround for whatever the initiative is. We're going to start it, we're going to align it and finish it within 90 days so we can see the beginning and end, measure the improvement, and then move on to the next thing. And so that process of how we manage all of that in the organization through quality initiatives, finance initiatives, human resource initiatives, whatever it is we're managing is systematic as opposed to sporadic. That's what we call our system of management. When we worked with VHA at the outset to say, what can we do together to enhance our partnership in a way that we're not going to go looking for dollars to save on units of pricing or just reconfiguring contracts with vendors, but what we really want to do is understand and have our physicians understand the cost of care and the choices they make, what's different among them, and how do they align in a new way to really be focused on the bottom line implications We thought, we might move from 3 to 5 million savings a year. I thought maybe 10 at the outset. What I didn't expect is that within 1 year we'd be saving about $16 million just on the products and supplies that we used before. But it comes from a partnership that has been very beneficial to us.
One of the best takeaways here is the importance of the shortened cycle. Brian and his team are so focused on creating a new cadence in that organization and shortening down the expectation for initiatives to be completed to 90 days. So that means you've got 4 quarters in a year, and every 4 quarters these teams are looking at achieving metrics. As you all know, supply chain initiatives, any of these change initiatives take a long time. So to shrink that down to 90 days is really revolutionary, and I commend Vidant for this effort. The other aspect, I think, or takeaway from the interview clips was the long-term, that a long-term investment in process improvement or a new system of management can evolve into a new normal. You may see at your organizations that you're achieving a certain level of success year over year. At Vidant, it was somewhere between $3 and $5 million they could expect to get from their supply initiatives. With this heightened focus and this improved quick cadence, they've been able to increase that to 10 million, 16 million is what Brian talks about. We're looking to get even more than that this year. So somewhere their new normal is going to be between 12 and 15 million year over year, and it has to do with driving resources through this open architecture and having this new cadence of 90 days to deliver results.